So one of the questions I get a lot from people in my field as a medical malpractice lawyer is, what is a stroke? And I think people think that a stroke is just one thing that happens and it's all the same. But the reality is there's actually two main types of strokes, and they can happen for all sorts of reasons. The first type of stroke that I see in my job all the time is called an ischemic stroke or an embolic stroke. And all that means is that there's a blood clot in the brain. Embolus means clot, so embolic stroke. And they sometimes call it an ischemic stroke because ischemia means lack of blood flow, which is what happens when you have a clot, is that the blood can't flow throughout the brain. And when the blood can't flow throughout the brain, you get a lack of oxygen, because blood is what brings oxygen to the brain. And when you have a lack of oxygen, things die, including your brain. So that's the first type of stroke. And this happens for all sorts of reasons. People who have high blood pressure or smoke, or a whole host of reasons. You can have a procedure that puts you at a higher risk for clot. You can have a clotting disorder. That's an ischemic or embolic stroke. The second type of stroke, which is totally different but can result in the same type of damage, permanent brain damage, paralysis, inability to speak, is called a hemorrhagic stroke. And that's a bleed. Okay, so we're not talking about a clot, we're talking about bleeding in the brain. And what happens with this type of stroke is there's a rupture or a bursting of the vein or artery in the brain, which results in blood pooling up. And obviously the skull is an enclosed space, so the blood can't go anywhere, so it has to pool up, and then that can put pressure on the brain. And when there's pressure on the brain, it's bad. And if that pressure on the brain doesn't get alleviated through draining the blood or operating, then that can cause permanent damage to the brain, the same way a clot can. So strokes are actually a lot more complicated than I think most people think. And hemorrhagic strokes can happen because of medication errors. Someone's given the wrong medication, given too much medication. They can happen because someone falls. They can happen because of high blood pressure. But regardless, both an ischemic stroke and a hemorrhagic stroke can cause extremely severe deficits and damage to the patient.